Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating Jared, a 47-year-old male who is brought to care by his wife because he is not the man I married 20 years ago. That's what she says. He denies any significant medical history, he takes no medication, and his remaining histories are unremarkable. According to his wife, she and Jared have been married for 20 years, have 2 children, and have lived a normal life. Jared owns a local construction company, and their marriage has been a solid one, characterized by the typical day-to-day issues that occur in most marriages, but otherwise happy. For the last 2 to 3 months, she says Jared has completely changed. He will get angry for no apparent reason and even broke a lamp once. He tells stupid and offensive jokes that no one else thinks are funny, and someone even called the police when he continued to make inappropriate remarks to a woman in a restaurant. Jared seems unsure what to say, but his wife is adamant that this is a totally different man from the one she has known. The psychiatric mental health nurse practitioner knows that Jared should be evaluated for A. Borderline personality disorder, B. Structural brain damage, C. Substance abuse disorder, or D. Cognitive impairment. So, this is basically a question about considering likely etiologies or likely differential diagnoses for the symptom presentation and then prioritizing them. What is the most important thing in this list for which Jared should be evaluated? Well, as you look at these 4 options, B is the correct answer. Personality changes that occur later in the lifespan, have rapid onset, and include impaired control of behaviors and emotions are most likely due to structural brain damage related to a head injury. Neoplasms and cerebrovascular disease are also considerations. A is not correct. In fact, we don't even consider borderline personality disorder here because personality disorders such as borderline personality disorder are usually evident well before the 4th decade. Substance abuse was not reported in the history, and we have to assume that this is true. Now, in real life, you may pursue that further if you are not certain that you have been given complete information. It certainly is a differential diagnosis that we have to consider for acute personality change. But on exam questions, you have to assume that the information presented is accurate. And at the beginning of the question, we are told that his remaining histories are unremarkable. And then finally, cognitive impairment is a much less likely issue here. While Lewy body disease has a similar presentation, it really does not typically present at 47 years old. And in order of priority, structural damage is just the thing that must be ruled out first. Remember, it is the most dangerous thing. It is also the thing that you can potentially do something about, if even just to arrest further deterioration. So as you evaluate these 4 potential etiologies, A, we can discount based on history. The history is not at all consistent with it. B, we must consider first because not only is it more likely, but it's a more compelling immediate differential since there are interventions that could perhaps improve symptoms and at the very least could prevent deterioration. Substance abuse disorder is something to consider, but we have to assume that the information we are given is accurate, and we are given information that his histories are unremarkable and non-contributory. And like I said, cognitive impairment, is it possible? Yes. Is it likely? Not really. And even if you had structural brain damage and cognitive impairment as your 2 leading differentials, you would evaluate structural brain damage first, again, because it is a potentially treatable and certainly arrestable differential. And so that's how we come to the best answer of those provided in this scenario being B.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.